Good afternoon, everyone. My name is Kelsey Hendall, and I am a program coordinator in the MCW Office of Community Engagement. And we welcome you to our third Community Engagement Spotlight of our monthly series. Please note that this session is being recorded. I'd like to begin with a statement from the Office of Community Engagement in honor of National Native American Heritage Month. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please be sure you are muted throughout the presentation. We encourage everyone to use the chat bar freely to share comments or post questions for our guest. We will be monitoring your questions throughout the session, so please feel free to submit any as they come to you, and we are setting aside a few minutes at the end for our guests to address them. We also hope that you will join us for our future Spotlight presentations, which will take place on either the second or third Wednesday of each month. So please look for information about upcoming guests on our Community Engagement website, and you can find that by searching MCW-CE Spotlight. We are so excited about our new monthly series, which features community partners and the important work they are doing for and with the community. We highlight their goals, motivations, and accomplishments and the ways they have partnered with people and programs at MCW. Today, we are deeply honored to have Cecilia Garcia as our CE Spotlight guest. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about Cecilia's important work for the community and her partnership with the Medical College of Wisconsin. Dr. Young.
Thank you, Kelsey. Cecilia Garcia is of Mexican nationality and has lived in the city of Milwaukee for 17 years and has served as a, as a community health worker for the Latino community for more than 8 years, seeking basic resources and direct connection with organizations that can provide services to low-income families. Helping her community has always been her passion. Cecilia has served as a specialist and an educator for her community through her work with the MCW All of Us Precision Medicine Initiative, and for Planned Parenthood, where she serves as a facilitator for sexual reproductive health classes and outreach health fairs and provides resources to the community around these topics. When the pandemic started, Cecilia and her family overcame difficult challenges and uncertainty to provide help for many families within her community. Cecilia assisted MCW and her community in the earliest days of the pandemic as part of the Creative Health Collective, focused on community-generated, equitable response strategies to COVID-19, facilitated by Dr. Zeno Franco and the City and County of Milwaukee. She helped to distribute masks, food, and diapers that she collected that became essential for the safety and needs of the families in her community. Cecilia also worked to distribute culturally tailored informational flyers about COVID-19 and facilitated access to healthcare to the community. This effort was recognized earlier this year by the MCW President's Community Engagement Award. Cecilia and her fellow nominees, Otis Winstead, Wade Fernandez, and Tu Fong Lee, ended up winning the award in the category of community partners for the exceptional work they had done and positive impact they had on their respective communities. These community health workers became the eyes and ears of the city's response to COVID-19 in communities of color, offering critical insights about how and where to direct services during the early days of the pandemic. The impact of this frontline work included delivery of hundreds of thousands of masks in collaboration with Mask Up MKE. Tens of thousands of pounds of food relief and household essentials such as diapers were also distributed. The team also provided referrals for rent, housing, and healthcare assistance. Cecilia, thank you for your dedication, your hard work, and the support you have given to improving the health and lives of the community members you serve. You are a valued partner of the Medical College of Wisconsin, and we are honored to have you as our guest today. At this time, I would like to introduce today's facilitator, Dr. Angelica Delgado Rendon, who currently serves as instructor for the Department of the Institute for Health and Equity and the Division of Epidemiology at the Medical College of Wisconsin. Dr. Delgado Rendon has experience in community research, teaching, program evaluation, education, and clinical diagnostics. She has worked on various health areas of priority, including nutrition, physical activity, depression, Alzheimer's disease, support programs, fall prevention, chronic disease management, and prevention of secondhand tobacco and marijuana smoking. Dr. Delgado Rendon is particularly passionate about studying the effect of empathy on behavior and teaching about Hispanic and Anglo races, culture, and health. She enjoys swimming and being with her family, friends, and her dog, Lupita. As I hand the session over to Dr. Delgado Rendon, we will be sharing a slideshow of images taken by our guest, Cecilia Garcia. Cecilia and Dr. Delgado Rendon will take turns describing what you see in both Spanish and English. Dr. Delgado Rendon, I pass the mic on to you. Thank you.
Hello, everybody. And thank you, Dr. Young, for the kind introduction of Cecilia as well as myself. So I don't believe that we need further introductions. Instead, we should just delve into the interview to get to know more about Cecilia and her fantastic work in the community. So at this moment, I would like to begin the interview. So what we're going to do is, Cecilia, I'm going to be asking the questions in both English and Spanish, and Cecilia will respond in Spanish, and then I will translate. I will interpret her responses. So that multiple audiences can enjoy this interview later on, Spanish-speaking and English-speaking communities. So, Cecilia, hi.
Yeah, hi. I'm sorry.
Hi. Great. I'm glad you are. Yeah.
Thank you, and thank you for introducing me.
Okay, excellent. So, Cecilia, thank you for joining us today. We'd like to get to know you a little bit better and your work. So maybe why don't we start with learning more about you. So please tell us a little bit more about yourself and your family. Cecilia, ¿por qué no nos platicas algo acerca de ti y tu familia?
Con mucho gusto, bueno, creo que ya dijeron mucho. Lo único es que, pues sí, soy promotora de salud desde hace 9 años. Tengo viviendo aquí en Milwaukee 18 años. Tengo cuatro niños, 2 niñas y 2 niñas, y pues me encanta muchísimo mi trabajo. Me fascina y es mi pasión ayudar a otros para que mis hijos tengan un mejor estilo de vida.
Okay. So Cecilia has said, with pleasure, I will tell you about myself. I have been a community health worker for 9 years, and I have been living in Milwaukee for about 18 years. I have 4 children, 2 sons and 2 daughters, and I do my work to improve my children's lives. And now, Cecilia, can you please tell us, how did you get involved with the work that you do now? Take us back to the beginning of you when you when you shifted from your previous work to this community health work. ¿Nos puedes, por favor, llevar hacia el principio de cuando cambiaste tu trabajo y comenzaste a trabajar en la comunidad? ¿Qué es lo que te empezó a motivar?
Bueno, a mí me motivó mucho por mis propias experiencias, porque en algunas veces yo he vivido lo mismo que muchas personas de mi comunidad están experimentando. Yo he experimentado esas mismas experiencias.
So Cecilia has mentioned that what led her to begin to work as a community health promoter was her experiences, that she experienced some hardships in her life, and that she realized that other people in her community had experienced the same hardships, and it was hard to find resources to help her out. So that's how she got started. Un poco más, Cecilia, de tu trabajo. ¿Cómo empezaste con tu trabajo con la planificación familiar or Planned Parenthood? How did you begin with that work of working with Planned Parenthood?
Oh, claro. Bueno, en nuestra cultura latina, no se habla mucho de salud sexual y reproductiva. Desafortunadamente, vuelvo y lo digo otra vez, por mis propias experiencias, a mí me gusta, bueno, si quieres decirlo para que no te diga tanto, poco a poco.
Yeah, said in the United States, it's not common that Hispanics talk about sexuality or sexual health. It's more of a taboo. And nobody provided her, when she was growing up, nobody provided her with that sexual education. Continúa.
Ya, sí, exacto. Entonces, de veras que yo veo en muchos hogares latinos que hay mucha falta de información acerca de salud sexual y reproductiva. Yo tengo en esta comunidad 2 varones tengo 2 niñas y 2 niños. Entonces, me empecé a involucrar más porque dije, yo quiero que mis hijos tengan una mejor educación acerca de salud sexual y reproductiva. Y cuando hablamos de salud sexual y reproductiva, hablamos de muchas áreas en nuestra vida.
So Cecilia has mentioned that there is a lack of education about sexuality here, and that she worried about her children. She has 2 sons and 2 daughters, and she wanted them to have that sexual education to be prepared for their lives. And that's how she got started working in Planned Parenthood. So,
Yeah. Y como yo,
el programa que era.
Se llama Cece Más, Cuidándonos Creceremos Más Sanos. Entonces, como yo como madre quiero un futuro bueno para mis hijos, también me gustaría que otras personas en mi comunidad tengan las mismas oportunidades y tengan la misma equidad en cuanto a educación.
Okay, so she has said she got involved with the Planned Parenthood CC More program, which aimed to educate people about sexual health, and that she hopes to increase. ¿Qué fue lo último que dijiste?
Que me gustaría que las personas tuvieran la misma equidad, la misma calidad de vida que muchas personas tienen, y eso me refiero al acceso de información y educación en todas las áreas que se puedan, especialmente, como vuelvo y te repito, créeme que la salud sexual y reproductiva abarca muchas áreas en nuestra vida.
Because she hopes that in this way, by educating, I think somebody needs to mute me, because she hopes that by educating people, that this could increase equity in society, because we are informing groups of people that may be at risk and that maybe don't know everything that the groups that are doing better off know. And so by this way, everybody is informed and everybody can live a better life. She's mentioned that she has a lot of empathy and patience for the community. So this way they can live better lives. Eso fue lo último que dijiste, ¿verdad?
Sí, yeah. Sí.
Ok. ¿Nos puedes mencionar un poco acerca de tu interés en la fotografía, en las fotos que has tomado para tu trabajo que vimos al principio y que vamos a ver al ratito? Can you tell us a little bit about your interest in all the photography that you've done for your work, and the one that we saw earlier at the beginning of this presentation, and we'll see a few more later on?
Sí, claro. Bueno, todas las fotos que he tomado normalmente nunca las he hecho públicas, las estoy compartiendo a ustedes, se las he compartido a Zeno en algún pequeño grupo que tengo por privacidad de las personas, pero las he recolectado porque creo que esto ayuda a que yo las veo y se las muestro a mis hijos a veces o yo misma, porque creo que debemos de concientizar de todas las necesidades que hay en la comunidad. Tenemos que ser más conscientes de las necesidades que hay, y esto me ha ayudado a que cada vez que yo las veo digo, wow, falta mucho por hacer en mi comunidad, hay mucho por hacer en la comunidad. So, es como algo que me está recordando todo el tiempo que no debo de parar de hacer lo que estoy haciendo.
Cecilia has pointed out that she likes to take pictures. She has documented all her work from the beginning to end, and she likes to take a lot of these pictures. because she likes to show these pictures to her children of all the work that she's been doing, but not so much to show off what she's doing, but more so to raise their consciousness about the community and about all the needs in the community. And also by sharing these pictures out into the public, she also raises the public's consciousness about the issues that the community is facing. And she mentioned that there are a lot of needs in the community that still needs to be addressed, and that she cannot stop to continue to work to address these needs. Wonderful, wonderful, Cecilia. Muchas gracias. Yes. We see some comments in the chat, if I may mention it. It says, it is wonderful, Cecilia, that you recognize your needs and then pay it forward by helping others with those same needs.
Thank you.
Dice que es maravilloso que Cecilia reconoció que tenía necesidades y luego, después de que ella consiguió los recursos, ella empezó a ayudar a otras personas también que tenían esas mismas necesidades. Y la profesora Stacy Young mencionó que el uso de las fotografías es un método muy poderoso para enseñar acerca de las necesidades de la comunidad. Dr. Young mentioned what a powerful use of photography to highlight community needs. Okay, thank you for those comments, and we'll move on to the next question. So, can you please tell us about how your collaboration started with the Medical College of Wisconsin? Particularly, how did you become involved in Dr. Zeno's projects, and what has it been like to work with the Medical College of Wisconsin? Entonces, si nos puedes platicar un poco acerca de cómo empezaste a trabajar, cómo conociste al doctor Zeno Franco, cómo empezaste a colaborar con él y con la Facultad de Medicina de Wisconsin.
Claro que sí. Bueno, en una ocasión vi que estaban solicitando personal para el programa de All of Us con el doctor Zeno Franco. Cuando yo tuve la entrevista con él y me dijo de qué se trataba este proyecto, realmente me interesó porque en la comunidad latina muchas personas no creen en la ciencia, no se involucran mucho en la medicina. Realmente volvemos a lo mismo. Me gustaría que la comunidad tenga la misma equidad y las mismas oportunidades. Entonces, yo veo esto como una oportunidad para que las personas se involucren más en su salud, crean más en la ciencia, y esta es una muy buena oportunidad de este programa científico. Para mí es algo que puede ayudar a nuestra comunidad a abrirse un poquito más a que necesitamos cuidar de nuestra salud e involucrarnos más en el área de salud, la medicina.
Okay, so Cecilia, I am now going to amaze you by translating everything she just said.
Thank you. I'm so sorry.
Let me give it, wait for it. Let me give it a shot. Okay. So, because I think I captured it. So Cecilia has said that she saw when she was working first at Planned Parenthood, she became aware that there was a project called All of Us, and that they were interviewing for positions for that project to work with Dr. Zeno Franco from the Medical College of Wisconsin. And so that she rise to the occasion, she went to the interview because she wanted to learn more about this project and to work with Dr. Zeno Franco in this research study. What she then said is that she thinks that many people in our communities either don't believe in science or are unaware of research. That maybe they don't know the potential that research has to help us to solve the inequities that we face in our society, and that she thought that this was an excellent opportunity to do so, to contribute to solve these inequities. She thinks that if we take care of our health and become more involved in these research opportunities, society can be better, and in turn, Hispanic community will be better off. Did I Did I say everything you said?
Yes, thank you.
Wonderful. I'm very happy.
Thank you.
Entonces, ahora platícanos un poco. Okay. How can people effectively engage with the community? How do you build that relationship? ¿Cómo es que tú recomiendas que la gente se involucre con la comunidad? Y estamos hablando, I believe here we're talking about the academics, estamos hablando de los profesores. ¿Cómo es que los científicos o profesores pueden formar esa relación con la comunidad como contigo? Personas como tú.
Bueno, creo que principalmente es crear confianza. Esa es una de las de los principales enfoques y lo que yo he visto. Con la comunidad hay que ganarse la confianza. Hay que crear esa confianza, esa conexión y sobre todo comunicación con ellos.
Okay. This is excellent. Thank you, Cecilia. So Cecilia has said that she would recommend scientists and researchers to first build trust with the community. And by that, she means it needs to be gained. The trust needs to be gained. It cannot be just given. They need to sort of earn it. And how do you earn it? Well, you create it. And you create it with communication, by communicating with community members.
Otra cosa que, bueno, y creo que es lo más importante para mí en este trabajo con mi comunidad es la empatía. Creo que ese es uno de los principales factores para tener una conexión verdadera con la comunidad, es empatía.
She has also added that another important factor for creating these partnerships with the community, these relationships, is with empathy. That one needs to have empathy for the other person in order to build these relationships. Ahora, parece que alguien tiene una pregunta. Déjame ver aquí en el chat. So there's a question. Somebody said, Dr. or Sarah O'Connor mentioned, muchas gracias, Cecilia. What are some of the ways you work to learn about the needs of the people in the community? This is an excellent question because I believe she was telling me about this last week. Cecilia, Sara tiene una pregunta aquí. Ella pregunta, ¿cómo es que tú te has enterado de las necesidades de la comunidad? ¿Cómo tú te enteras de eso? ¿Cómo te has dado cuenta?
Bueno, pues empecé una relación con un grupo de familias. Este grupo de familias me fue recomendando con otras personas. Conéctense con Cecilia. Ella es muy amable, ella te va a entender, ella te va a ayudar. Fue como una cadena de información entre la misma comunidad que me han referido. Empecé con grupos, vamos otra vez con el plan Parenthood, hacíamos grupos de 10 personas y les gustaba cómo trabajaba yo. Entonces, me recomendaban otros grupos y me hablaban de otros lugares. Entonces, cuando empezó lo de la pandemia, mucha gente me empezó a contactar porque ya me conocía que estaba yo trabajando. Y fue como una cadena, una pirámide, fueron pasándose los contactos y llamen a Cecilia, ella es muy buena, ella te va a entender, ella te va a ayudar y se hizo un grupo grande. Fue algo, para mí fue una sorpresa y todos los días me sigue hablando gente diferente.
Okay, thank you. Again, I will do my best. Está perfecto, porque lo que estás diciendo lo dices con emoción y no te quiero interrumpir. Espero que haga la justicia en la traducción. What I said is I'm going to translate and I don't want to interrupt her because she is very passionate about when she's speaking and I want her to say what she wants to say and I want to hopefully translate that passion in her answers as well. So she mentioned that the way she has found out about the needs in the community, well, in the beginning, she started to just relate to a group of families. She began to just talking with that group of families, and then it became a chain sort of a chain that families refer her to other families and so forth. She just increased her social network in the community. Eventually, she began to work at Planned Parenthood. And from there on, she was recommended to other people in the community, and that there was sort of a word of mouth that happened. This, ¿cómo se dice? This snowball effect that people just began to know her more in the community. And then eventually when the pandemic hit, she was already known in the community. And so people who knew her just began to call her immediately to ask her questions, to ask her for help. And then they began to refer her to other people that they knew. They would say, call Cecilia, you know. And so for help, because they knew that she could try to help them out. So it's all been mainly via building those relationships and gaining the trust of the people around her, I believe, because if they recommended her and people know her, then it's easier to work with them when a new issue arises. Even though I'm surprised, she did not say that. I'm adding this, by the way, that she was working with Planned Parenthood, she was working with the All of Us project. And then when the pandemic hit, the people who already knew her from her previous work were calling her to ask her questions about the pandemic. So it just goes to show that when somebody has that network, it's not only about, doesn't have to be only about that one issue, that the networks can work to address emerging issues. En Cecilia, lo que acabo de decir es que lo único que añadí fue que es muy impresionante cómo te conoce la gente en la comunidad, porque aunque tú trabajaste con Planned Parenthood y trabajaste con la investigación de All of Us, cuando empezó la pandemia, todos te empezaron a buscar y te empezaron a llamar para hacerte preguntas, aunque tú no habías trabajado en la pandemia, era algo nuevo.
Yo pienso que fue porque siempre estoy abierta a ayudar a la gente, porque confían en mí, porque saben que siempre por lo menos tengo una palabra de aliento para darles. Entonces, es lo que digo, cuando uno tiene empatía y respeto y trata a la gente con esa empatía y ese amor, yo siento que a la gente le corresponde a uno con esa confianza. Y creo que es lo más importante para mí y de verdad que no tiene precio todo el cariño que me tiene mucha gente. De verdad no sé cómo expresarlo, pero es impresionante y de verdad a veces me sorprendo yo misma.
So Cecilia has added that people call her because she is always open to helping them. Even if sometimes she's only helping them by giving them a word of support, only some words of affirmation. She said that she further has added that she believes that she has provided the people with empathy, respect, and love. And that when she has done so, they have corresponded with their trust in her. And for her, she says, there is no price to this. There is no price to this trust, to this love that people have given her in return for her trying to help them out. I'm going to ask her, and now I would like to ask her about, since we started talking about COVID already, I would like to ask you, Cecilia, how has COVID-19 affected your work and your community? ¿Nos puedes platicar? Ya empezamos a hablar un poco acerca de COVID. ¿Nos puedes platicar cómo COVID afectó a la comunidad y tu trabajo? Y después, primero, ¿cómo afectó a la comunidad hispana en Milwaukee? Y después, ¿cómo es que tú empezaste a trabajar en eso?
Ok, ¿cómo afectó a la comunidad hispana el COVID? De verdad que vamos otra vez, especialmente en el sector salud. Eso fue un impacto grandioso. La salud, en el área de salud impactó mucho a la comunidad. Volvemos a lo mismo. La gente no cree mucho en la ciencia, no creían en este virus. La gente simplemente como que había gente que estaba espantada, había otra gente que no creía, había personas que no sabían qué hacer. Eso fue, sobre todo creo que volvemos a lo mismo, que hay falta muchísima comunicación en la comunidad, mucha información y educación.
So she says that she believes that COVID affected the health sector of our community, that it affected our health severely. And she says, but everything goes back to science, that she thinks when the COVID first hit our communities, that some people didn't believe in science, some people didn't believe that the virus existed, but then other people were scared. I mean, some people did believe in the virus, but it resulted in them being scared and being sort of not knowing what to do. And now, Cecilia, how did you start to work to address this COVID situation? Tell us about what you did in the community to address the COVID pandemic in the Hispanic community in Milwaukee. Ahora, Cecilia, ¿nos puedes decir acerca de tu trabajo? ¿Cómo es que comenzaste a ayudar en la comunidad latina para alivianar los problemas que trajo COVID a este lugar?
Sí, perdón, como te mencioné, una fue el sector salud y el otro pues fue la economía, ¿verdad? Entonces, como te vuelvo y te repito, ya tenía yo muchas personas que me estaban llamando, habían perdido su trabajo, se estaban enfermando, no tenían dinero. Entonces, primero que nada, había mucha gente que necesitaba comida. Empezamos a buscar despensas, comida. Empezamos a buscar despensas. Mi familia y yo empezamos a hacer despensas y le dimos a algunas familias que, como te digo, ya me estaban contactando para decirme, es que ya no tengo trabajo, estamos enfermos y buscamos la forma. Yo le pedí a mi familia dinero para poder empezar con las primeras despensas. Luego empezó el problema de los alquileres. Después, pasó más tiempo. Había gente que estaba enferma, gente que tenía, por ejemplo, mamás solteras que tenían bebés, no podían trabajar, no tenían para pagar renta, no tenían para comida, no estaban agarrando food stamps, no estaban teniendo para pañales. De verdad que ahí fue donde yo dije, tengo que buscar la forma de ayudar a estas familias. Y le preguntaba a algunas de mis familias y amistades si me podían cooperar con algo, despensas, jabón, con lo que tuvieran para poder ayudar a estas familias con lo que se pudiera.
One second. Thank you. So Cecilia said that, as she mentioned earlier, the pandemic affected our health, the health sector, but it also affected our economy, the economy of the Hispanic groups here in Milwaukee. And as mentioned earlier, she's a part of a social network already that people knew her from before the pandemic. And so when the pandemic started, many people began calling her. She was surprised that she began to be flooded with phone calls from people who knew her, who were telling her that they lost their jobs, or that they were sick. Some of them were sick and couldn't work because they were sick, with COVID, or that they didn't have money. And some of them called her to tell her, I don't have food. I don't even have food, to feed my family. And so she says that her family, at the beginning, they tried to start to make some food packages to take to some of these people that were in need. She says that a lot of people who were calling, they were, like she mentioned earlier, they were sick and mostly affected. Sometimes she would hear from single mothers who, because they were single mothers, and remember that children were out of school, right? They had to stay at home. And so these single mothers could not work, and they couldn't pay rent. They couldn't afford to buy food for their families, again, because they couldn't work. And so they would call her. And so what she did was she called her family and she called her friends. She called everybody that she knew of, to try to say, please help me, whatever you can provide me, so she could make these packages, these sort of care packages, and try to help these women and people as much as possible during the pandemic. So, excelente, Cecilia. Thank you, Cecilia. Y platícanos acerca de tu colaboración con Zeno, cuando llega el proyecto, con el doctor Zeno Franco. Cuando llega el proyecto con el doctor Zeno Franco, ¿en qué manera ayudó esa colaboración? ¿Cómo te dijo doctor Franco de este proyecto y de que lo que podían hacer con platícanos más de las máscaras y todo eso? So now I'm asking her, when the opportunity arose to work with and for Dr. Franco on the Advancing Healthier Wisconsin grant to address these COVID inequities, to tell us more about that work. Cecilia?
Sí, claro. Bueno, cuando el doctor Franco me comenta que tenemos este programa y me dice, vamos a poder tener acceso a mascarillas, porque mucha gente no tenía mascarillas y estábamos buscando la forma de ayudar y pues vimos la oportunidad. Entonces, la verdad, pues Michael fue una persona que pues sí nos ayudó, y el doctor Zeno, o sea, creo que todos fuimos un equipo excelente. Nos empezó a decirme, ¿qué es lo que necesitas? Ok, yo vi la oportunidad y necesitamos pañales, despensas, mascarillas. Fue para mí algo grandioso, porque los negocios estaban desesperados también, no tenían ni un cartel, se estaban haciendo printeando sus propias hojas para que la gente no entrara sin mascarilla. Cuando nosotros empezamos a distribuir los flyers aquí en el sur de Milwaukee aquí, los negocios estaban súper agradecidos, porque decían, tenemos meses y nadie nos ha traído nada, hemos buscado la forma de, solamente los negocios grandes. Es donde yo digo que no hay equidad para la clase pobre, la clase media. Porque a los negocios grandes les proveyeron grandes letreros e información, a los negocios pequeños los olvidaron por completo. Y para los negocios estaban muy agradecidos por lo que estábamos haciendo. La gente estaba muy contenta con las mascarillas. La gente que tenía COVID, que empezamos a darles comida y en las puertas de su casa, ya tuvimos más acceso a despensas. Les dábamos a la gente que tenía COVID la comida enfrente de sus casas. De verdad que eso fue para mí como, wow. Ya, yo sé que no tenemos las toneladas, pero estamos haciendo más. Así es, así fue como impactó para mí este programa, y la verdad creo que mucha de la comunidad está súper feliz y agradecida por lo que hicimos, por el apoyo que tuvimos de este programa.
Thank you, Cecilia. So, Cecilia, Cecilia has mentioned that in the beginning, Dr. Franco approached her to tell her that they have some money, perhaps, to provide masks to the community. If we go back to the beginning of the pandemic, everything was sold out in the stores, right? There were no masks, hand sanitizers, and so forth. So she began to work on her collaboration with, she mentioned Michael and Dr. Franco, and she said that they formed this team, and they began to brainstorm, what does the community need? What do we need to do to address this need? And so she told Dr. Franco, that she needed money. And she said, what we need is masks, diapers, food, as well as information for businesses and for the community at large. Then she said that they became a team, right, to address the situation. She noticed that businesses in the community, those small businesses, were desperate for information and for documentation about COVID, because they were printing their own materials, their own announcements about requiring masks when they come into the store and so forth. And some people, some customers may not feel like those were legitimate posters, one may say. And that she thought that's where the inequity comes in, because she saw the big businesses, they got a lot of resources. and they had all these posters and all this information for them and for their customers about COVID. But the small businesses did not get the same help as the big businesses, at least what she was seeing when she went out to these businesses. So one thing that she began doing is delivering posters at all these small businesses so that they could have the information and require their customers to wear masks when they came in. Also, she began to help families that were personally affected by COVID because they were affected by COVID, they were supposed to quarantine and couldn't come out. So they would make those food packages and deliver them right outside of their home. She has further added that she's extremely grateful for the economic support that she was given in order to carry out this work. One moment, let me see here. And thank you. So we have a few comments in the chat, if that's okay to refer to this in a few minutes. Christine Seller says, well done, Dr. Regado Rendon. Thank you, Christine. Sarah O'Connor says, thank you for that amazing description of how trust and empathy are key to all the work you do. Entonces, Sarah O'Connor dice que muchas gracias por describir cómo la confianza y la empatía son factores importantes para todo el trabajo que tú haces, Cecilia. Kathy Gale says, have you observed that COVID has resulted in isolation and loneliness in your community members? So, una pregunta breve. Pregunta Kathy Gale, ¿has observado que COVID ha resultado en soledad e isolación en la comunidad, en algunos miembros de la comunidad?
Sí, claro, demasiado. Y creo que ese es algo que hemos visto, bueno, estoy viendo muchísimo. Y no sé si se refiere a eso, pero ahorita lo que es las enfermedades emocionales y mentales están muy por encima de otros tiempos. Estamos viendo, este es un impacto súper agresivo en nuestra comunidad, en los jóvenes, en los adultos. Estoy viendo, me han estado reportando en las escuelas mucha agresión por parte de los jóvenes. Están ansiosos, están enojados todo el tiempo, están muy frustrados las familias. O sí, es una, la verdad, a veces encontrar espacios para terapia para alguna familia es difícil porque está tan saturada esa área que es impresionante cómo el COVID está impactando. Ahorita que se supone que al final estamos casi alivianando todo lo que pasó. Mucha gente está muy afectada socialmente, algunas personas tienen pánico social, estrés, es un sinfín de factores que está dejando o que dejó el COVID a muchas familias.
Gracias. I'm going to try to summarize. Cecilia has mentioned that yes, she has noticed a lot of isolation and loneliness in the community, and most of all, she has seen how it has affected the people's lives in that there is a lot of social panicking, stress, anxiety, and depression. She has said that she has spoken with many community members and that it's been hard to find slots for them to get therapy. Well, something she didn't mention this, but I will. You know that due to this pandemic, a lot of people require therapy to deal with this stress. But for Spanish speakers, there's an added level of trying to find a Spanish-speaking therapist or one with a good interpreter, right? Like what I'm doing right now. And so in Milwaukee, there is a shortage of Spanish-speaking therapists and Spanish-speaking doctors and psychiatrists. So you can imagine, right? Cecilia, is that right? That it's been much harder to find.
Creo que también esto tiene mucho que ver, recuerda, mucha gente que no tiene aseguranza.
Oh.
Esa es una cosa, es lo que te digo, sector, eso es lo cuando yo me refería al sector de salud. Mucha gente no tiene aseguranza, entonces es algo difícil para muchas familias.
Yes. So Cecilia said that also because of insurance, a lot of people don't have health insurance. So there's that also that barrier that they don't have insurance to deal with this situation. Now, sorry, we only have some minutes left. So I'm going to see one last question to address. Cecilia, thank you. I see there's a couple more comments in the chat, but
I see.
if I can address two questions to wrap this up, and then I'll give some closing statement. Alison Devan pregunta que si también has visto que las enfermedades crónicas han subido debido al COVID en la comunidad. Alison asked if Cecilia has seen that there's been a rise in chronic disease in her community due to COVID.
Sí, claro, especialmente para las personas que ya tenían problemas crónicos anteriormente, y recordemos que esta enfermedad deja casi 90, puede dejar 90 secuelas en el cuerpo, y sí, efectivamente han crecido más las enfermedades crónicas, definitivamente.
She has said that even before the pandemic, sorry, so people need to mute. She's mentioned that even before the pandemic, the community was affected by many chronic conditions. And so this COVID pandemic just added a burden to those morbidities, right? And that when we're talking about COVID, a lot of people who have had COVID have sequels, that's what have
sequels.
What is called long-term effects due to COVID. So we still remain to see all the effect that the pandemic has had, not just from COVID, but also from the other chronic conditions. And ahora una última pregunta. One last question for Cecilia. How can people support your work and your community? ¿Cómo la gente puede apoyar tu trabajo y a la comunidad? ¿Cómo recomiendas que lo hagan?
Bueno, realmente me gustaría, pues, si alguien trabaja en alguna organización, que comenten lo importante que es crear un sector más accesible para que la gente cuando venga a pedir ayudas no se le haga tan difícil tener acceso a los recursos.
Cecilia has mentioned that if you work for an organization, that you talk to the people in your organization about what we have talked about today, about the needs in the community, so that when there is a need, it's easier to access those resources.
Voy a dar solamente un ejemplo, perdón. Cuando estuve mandando el link para que la gente aplicara para la asistencia de renta, es un ejemplo rapidito, mucha gente no pudo aplicar porque era un mundo de papeles que la gente no entendía cómo llenar. Había personas que no tenían acceso ni a una computadora.
¿Y tú les ayudaste?
Algunos les ayudaba y porque a veces no nos tenía la gente que llevar papeles o mandar papeles. Yo no tenía todo lo que necesitaba yo aquí, como un fax para mandar los papeles. En la clínica 16, pues todo estaba muy restringido. So no tenía yo acceso. So ese es el problema a veces.
Okay. Cecilia has said that she can give you an example of how we can help community members. That, again, during the pandemic, she began to send her people a link to sign up for the subsidies for rental subsidies that they had, that the government was giving. But there was a lot of paperwork to fill out, and even more so, people didn't have access to computers. They didn't have access to internet, to all of these. And then they didn't understand how to fill out all the paperwork in order to get the help. She tried to help some of them, but of course, she has some limitations, right, to what she can do. So there is some things that you can personally do. As well as she mentioned, she collaborated with the 16th Street Clinic also to help people. So you can also volunteer there or help in other community organizations. ¿Es todo lo que quisieras comentar en este momento?
Sí, creo que sí. Si no tiene más preguntas, sí.
Okay, I think that we can close at this moment. If I can provide with a closing statement. Okay. Hold on. Oh, I need to, sorry. Can you see the slides? I'm trying to get out. Sorry. Okay, you can see the slides. Wonderful. Okay. So now I am going to give some closing remarks to today's session. More often than not, mass media tend to focus on negative news and therefore tend to be biased towards negative stereotypes of Hispanic communities in the United States. Our social, political, and health problems are magnified on everyday dealings. Even on Cinco de Mayo, we might hear how show specials, talk about how to turn Mexican recipes to be healthy. So contributing to the stereotypes that even our foods, all of our foods are unhealthy, right? In turn, scientists may inadvertently reinforce those stereotypes by the way they frame the problem and the methods used to study and solve the issues affecting Hispanics in the United States. So, for example, what happens is when scientists work unilaterally, that means on their own, without community guidance and participation, the results of that research may actually perpetuate the inequities that they are trying to address. We see that media disseminates some of these research results as, Hispanics more likely to be obese, Hispanics more likely to have type 2 diabetes, Hispanics more likely to die from COVID. And so then we begin to ask this question, and I saw this online, I had to share it. Are Hispanics, being Hispanic, a risk factor in general? And that's often how the problems are phrased, as if being Hispanic was in and of itself a problem. The media less likely shares positive information about Hispanic cultures, our family values, our interconnectedness, our resilience, our hard work. Cecilia's work is a perfect example of the strengths of our community. Academia should incorporate people's strengths into their research, study their health protective factors, and disseminate positive health outcomes as well, and not just the negative ones. For example, just to mention, the Hispanics tend to have very good birth outcomes, as well as longevity. They tend to live longer than some other racial and ethnic groups. In 2008, the Medical College of Wisconsin first identified community engagements as an institutional mission. In 2012, the Office of the Senior Associate Dean for Community Engagement was established. Community collaborations have always been an important part of research being conducted at the Medical College of Wisconsin, especially projects focused on the social determinants of health. In April of 2020, the Advancing Healthier Wisconsin Fund awarded Dr. Zeno Franco a grant to work with community workers such as Cecilia in the fight against COVID. In this project, they were able to do a lot of amazing work for the community, such as delivering these food packages and other essentials, providing information about screening and vaccinations, providing masks, helping some mothers with essentials such as diapers for their children, as well as identifying key messages and rapidly disseminating those key messages to the Hispanic audiences in English and Spanish. They hire community workers and serve more than 3,500 families and serve nearly 350 businesses and organizations, as well as distributed thousands and thousands of cloth face masks. The collaboration of Dr. Zeno Franco and Cecilia Garcia is an excellent example of how scientists can collaborate with community members and make a real impact in society. And when working with community partners as equals, amazing results can happen that would not have happened when working alone. So I hope that Cecilia's talk today has inspired you to be active in this community, either personally on your personal time or as a collaborator, as Dr. Zeno Franco has done with Cecilia Garcia and others in the community. So those were my closing statements. Do you have any questions, or Dr. Stacy Young, are we wrapping up, or Christine Seller?
Excellent. Thank you so much, Dr. Delgado Rendon. Thank you, Cecilia. It was an outstanding discussion that you had. Appreciate the comments and the questions in the chat. We have, excuse me, a final slide up that you can scan for getting connected for further information and for donating time or other resources. Our next spotlight is Wednesday, December. Actually, if you could go back one slide, please. There's we have an upcoming our upcoming session. Yes, thank you. Is on Wednesday, December 8th at 4 o'clock as we spotlight Kathy Gale, who's the executive director of the ERA Senior Network. So we're really looking forward to our next session. Thank you for joining us today. Also, please watch for evaluation to fill out as well for the session. So thanks again for your time and have a wonderful, wonderful evening.